spoke with a doctor and the first patient in Alaska to use cutting-edge technology in breast cancer treatments. Let's check it out.
People say that when you have your first child, it'll be a love like you've never known before. And I agree, it's just incredible. But finding out that you have cancer is sort of that same level of shock and awe and life-changing emotion.
I met Blair basically the way I meet most of my patients, which is an initial consultation. She came to my office, and due to her young age, I knew that we had to discuss genetic testing and then cosmetic options in terms of the reconstruction. I think it's an exciting time in breast care. I go to a conference probably once a month. It's a bit overwhelming. But when things change in breast care so quickly, you have to be on the cutting edge. Biosorb is a proteinaceous matrix that the body will reabsorb over time, and usually about a year, but everyone's a little different. You were probably, I think, the first patient that I used it on here in the state of Alaska. It allows for ingrowth of tissue around the implant with the clip markings, so you get to mark the cavity, and you get to have a structural support that you can bring tissue over and you can use as a scaffolding. And in some cases, I actually use the Biosorb matrix to create volume in the patient that has lost a significant amount of volume while the patient has a chance to heal.
I ended up with a fantastic oncologist who I just chose by the name, and I love her dearly still. I found the greatest surgeon for me that I could possibly find, and I feel super positive about my results from my surgery. The trouble with breast care is it changes so quickly that we can't say this is what we were doing last year and think that it's going to be adequate for treating this year. We have a lot of competent breast surgeons in the state of Alaska, but I think that, you know, there's a lot of technology that can be brought here, and within 1 year in practice, we've done that. I'm hoping that other providers will start integrating this into their practice so that women and men who are afflicted with this cancer can have benefit by it.
It's time